Okay, well, good morning, everyone. I'd like to welcome the new residents and fellows. My name is Jim Trovato. I am a professor in the Department of Practice Sciences and Health Outcomes Research here at the School of Pharmacy, and I also serve as the administrator for our Office of Continuing Pharmacy Education. So welcome again. So today we're going to talk about pharmacotherapy rounds, and I would say most of the fellows and residents in the Baltimore area are required to do a pharmacotherapy rounds presentation as one of the residency requirements. The reason why I'm here really talking about this is because the majority of the pharmacotherapy rounds will be accredited or approved for continuing education, continuing pharmacy education. Even if your pharmacotherapy rounds is not CE accredited, this would still be good practices in terms of the information that I have to share about pharmacotherapy rounds. So these are delivered, as you can see here, by you, the resident or the fellow, typically evidence-based drug therapy. But if you kind of think about it, really with any presentation, we kind of, and especially those that are related to continuing education, we think about the needs assessment or the gap analysis. So as a resident or a fellow, as you're putting together one of these presentations, really thinking about how it's going to benefit pharmacists in practice. So maybe thinking about, oh, what are pharmacists currently doing? What could they be doing better? And this is how your presentation is going to bridge that gap between current practice and what we could do, be doing better in practice. So really you're sharing, kind of thinking about what is the purpose of your pharmacotherapy rounds. They are held here at the School of Pharmacy as well as at the Johns Hopkins Hospital. And again, the target audience is, it does vary, but primarily advanced practice clinical pharmacists and trainees. So a goal is to enhance and apply participants' knowledge regarding use of drug therapy, treat, prevent disease, innovations in pharmacy services, or other hot topics. It doesn't necessarily have to be clinical in nature. I mean, it could be pharmacy administration focused as well. So as a speaker, you are learning to evaluate the scientific literature because the presentation should be evidence-based. We think about evidence-based medicine and then how this applies to practice. You will also learn to present complex concepts and scientific data in a clear and concise manner. So the requirements may have varied. I'm not sure if this slide needed to be updated, but for the most part, as a PGY1, you have a 30-minute or 1 hour pharmacotherapy round presentation. PGY2, 3 fellows is a 30-minute presentation, but I would ask that you check with your program director in terms of the duration of your pharmacotherapy round presentation. In the past, we've had required attendance for pharmacotherapy rounds, so again, check with your program director. There are 2 major components really with any presentation, I feel, whether it's a continuing education or otherwise, is that each pharmacotherapy round should contain an active learning strategy, as well as assessing the audience's achievement of the learning objectives and giving feedback to the audience. So those are 2 important concepts that I'll talk a little bit more about. Finally, there should be feedback to you as the presenter. And there will be audience evaluations, as well as I believe that as a presenter, you will select a mentor, but in addition to the mentor, you'll select someone to evaluate you. Sometimes that evaluator is a content expert in the area of your pharmacotherapy rounds. So it is important that you receive feedback as well. The schedule will be published online, whether it's Johns Hopkins or here at University of Maryland. Typically at Maryland, they're on Tuesdays and Wednesdays from 12:30 to 1:30. Kathy, I'm not sure if Hopkins is still Wednesdays at 12. Yep, thumbs up. Okay. So this is typically a schedule. And again, everyone is encouraged to attend all and any pharmacotherapy rounds. So, if you're here at Maryland, you want to go to Hopkins to attend rounds, you should do that, especially if it's a topic of interest and vice versa. Now, in terms of your topic selection, I kind of, mentioned about, thinking about, what you hope to accomplish. What is the needs assessment, the gap analysis, the purpose of our topic. We do encourage residents, fellows to work with the program director as well as a mentor. I know here at Maryland, we do assign a mentor for the resident or fellow in terms of developing their pharmacotherapy rounds. But again, selecting an appropriate and timely topic. We do ask that you not duplicate presentations from the past 2 years. Although again, you might have a similar topic, but maybe the data or the information has changed over the past 2 years. You're going to present new information, and that would be acceptable. Again, thinking about your audience, and typically it's advanced practice clinical pharmacists. So making sure that you're again gets back to that needs assessment. Why am I doing the presentation? How is it going to benefit pharmacists in practice? There will be instructions that are posted as well and disseminated to you in terms of getting the approval of your topic. So the topic title should be emailed to the email here at least 10 weeks prior to the presentation date. So there is an approval process for pharmacotherapy rounds, especially since it's being approved for continuing education. So prior to submitting your completed application, your mentor must review and approve the title and learning objectives prior to submitting your application. And this is really sort of a double check. I actually will receive your application for pharmacotherapy rounds since, again, it's being approved for continuing pharmacy education. And oftentimes we'll get, things will be filled out incorrectly. I want to get to sort of the common errors that occur with the application. But that's why we ask for the double check, having your mentor review that and approve that title, learning objectives prior to submitting the application. We try to minimize the back and forth in terms of addressing any errors. Also, I mentioned about the evaluator. The evaluator must agree to be an evaluator for the CE presentation, and you'll also indicate that on the application form. Are there any questions regarding the roles of the mentor or evaluator? Okay, and if you do have questions, contact your program director. We ask that the mentor and the evaluator not be the same person. You probably, if you think about it, the mentor is someone that's going to be intimately involved in helping you develop the pharmacotherapy rounds. And we'll talk about disclosure forms. As most of you know, maybe some of you have already done a continuing education presentation, but anyone that can influence the content of a presentation needs to submit a conflict of interest form. So we ask that the evaluator be someone not involved. So this way they can really have an unbiased review and feedback of your presentation. They're not involved in actually the development of that CE presentation. So again, you'll need a mentor and you'll need an evaluator, ideally they're different folks. And if you have any questions as I'm going through this, don't just yell out, raise your hand. I know it tends to be a lot of information. So again, the pharmacotherapy rounds application process. The application must be submitted. Now, you might be asking yourself, well, why are there all these rules and the timelines? And why do I have to submit my application so far in advance? So I just want to clarify that you are actually putting together a continuing education presentation, correct? Most of you may be familiar with ACPE, the Accreditation Council for Pharmacy Education. So the School of Pharmacy is an accredited provider of continuing pharmacy education. So we need to follow the standards of ACPE as a provider of continuing pharmacy education. So a lot of these rules and guidelines that I'm sharing with you come from ACPE. It's not something that we make up myself or as a school of pharmacy. So we need to adhere to the standards so we can be reaccredited, kind of like accreditation of doctor of pharmacy. In fact, that's what ACPE does, right? They accredit doctor of pharmacy programs, and they also accredit CE providers. So there is a hyperlink that you will receive. We do ask that we receive the application at least 45 days prior to the scheduled date of your pharmacotherapy rounds. There's a bunch of information you'll see here that I've kind of outlined in terms of what goes into the application, speaker, credentials, title, email. Again, I mentioned CV and conflict of interest forms. So typically, we ask of this from the speaker, you, the presenter, as well as the mentor. Because again, anyone that has influence over the content. So if there's someone else that's going to be involved in the development of your pharmacotherapy rounds outside of yourself and your mentor, that person would also have to submit a CV and conflict of interest form. I mentioned educational needs assessment. That gap analysis. What is the purpose of your CE presentation or your pharmacotherapy rounds? How is it going to bridge that gap in practice? for the pharmacist. You're going to have the title, the date, activity type. We'll talk a little bit more about that, and learning objectives coming up. I mentioned active learning. We'll talk more about that as well. And then also, given the feedback part. You'll have to provide the information about your program director or mentor and the evaluator and so forth. Final activity content, including PowerPoint presentation slide, must be submitted 14 days provide. And again, when I receive your PowerPoint presentation slides, I'm also, as we'll get to, I'm reviewing it for, is it free from bias, commercialism? Are the learning objectives aligned with the activity type? Is there an active learning component as part of your presentation? So this is why we ask 14 days, because then if we have to come back to you to make any changes, we can do so prior to your presentation date. New this year, the pharmacotherapy rounds presentations will be recorded. Now, this only applies to pharmacotherapy rounds accredited by the University of Maryland School of Pharmacy. For example, we do not accredit the pharmacotherapy rounds at the Johns Hopkins Hospital as an example. As a resident or fellow, you will have the option to opt out if you don't want your session recorded. The reason why we're doing this is we're going to use the recordings to create home study, continuing education activities. The home studies will be available to the public for 1 year and then archived. Questions about this? Now, there is an ACP requirement that speaks to, this is one of the standards from ACP called integrity and independence. So this actually evolved from the standards for commercial support. So really, it's to ensure independence in creating these CE activities, meaning that your presentation is not being influenced by outside forces. Specifically, we'll talk about ineligible companies. And an example of an ineligible company would be like a pharmaceutical company. Again, we're looking to make sure that the content is not, it includes commercialism. You're not trying to promote products or services from an ineligible company. And that's really the basis for the standards for integrity and independence. So again, not getting outside influence, which is why anyone involved in the development of your pharmacotherapy rounds needs to submit a conflict of interest form. We're going to talk more about developing learning objectives, writing appropriate learning objectives, making sure they're involved in activity type. You're hearing me say activity type. Two main activity types are knowledge type activities and application type activities. Hopefully, all of our pharmacotherapy rounds are going to impart knowledge to the learner. But then it's also important, although not required, is can they apply that knowledge? And you can design your pharmacotherapy rounds to do both, impart knowledge as well as have the learner apply that knowledge. If you're going to have them apply that knowledge, then it becomes an application type CE activity as opposed to simply a knowledge type activity where they're not actually applying the knowledge. So depending on which one you choose, you need to make sure that the learning objectives are going to be aligned with that activity type. So we'll talk more about that. You're going to need to describe your active learning component. We'll talk about that too. Again, that needs to be aligned with the activity type, whether it's knowledge versus application. And then again, how are you going to assess that the learner, the people in the audience, have achieved the learning objectives that you set forth and give feedback to the learner? So again, just getting back to the standard 5, integrity and independence, we want to ensure that the content is valid, again, evidence-based, references. The education should be fair and balanced. You're not advocating for a particular product or service. And also, you're not intended to advocate or make recommendations that are not adequately supported by evidence. So again, making sure the content is valid. I already mentioned commercial bias in marketing. I think that's pretty straightforward. Not promoting and selling products. And then if we do identify, the standard does spell out that if we do identify potential commercial bias marketing, or maybe someone submits a conflict of interest and they have a potential financial relationship with an ineligible company like a pharmaceutical company, you will need to mitigate that as well as disclosing the relevant financial relationships with these ineligible companies. Questions so far? A lot of information. show of hands, how many folks here have actually delivered a CE presentation before? Oh, good. So a good number. Okay. So this sounds familiar? Yeah, good. And then I would encourage you to work with your colleagues here and help them as they develop their applications for pharmacotherapy rounds as well. Okay, so again, provide the balanced view of therapeutic options. Again, you shouldn't have a presentation if you're talking about cardiovascular disease, maybe high blood pressure. You're not just focusing on one treatment or one medication. We do talk about using generic names if possible, not referring to drug products by their brand names. Avoid using drug images, product logos, and so forth. So it's kind of common sense stuff. But again, the recommendations should be based on current science, evidence, and clinical reasoning while giving a fair and balanced view of the diagnostic and therapeutic options. Can you discuss off-label uses? Absolutely. When you get to conflict of interest form, you're going to have to disclose, yes, my presentation involves the use of off-label medications. You would just designate what those are, but that is allowed. I mentioned the conflict of interest form. So again, anybody involved in the development of the content or has influence over the content of your pharmacotherapy rounds needs to complete a conflict of interest form. Again, this is where you're going to disclose any relationship you have with ineligible companies. And again, it's okay. You may have a relationship with an ineligible company like a pharmaceutical company. We need to disclose that. But then we also just need to make sure that the content in your rounds is not representative of product services of that ineligible company that you have a relationship with. So that's something that we'll work through that. Okay, that's all I want to say there. I mentioned CE activity types. So this slide is showing you a summary of these different types. The two main types are knowledge application. There is a third type, certificate programs, which you will not be doing that because it involves too much time. I mean, you could, but most of the residence fellows will develop a knowledge or an application type CE pharmacotherapy rounds. ACPE does designate the minimum credit. So for a 15-minute presentation, meaning knowledge has to be at least 15 minutes, could be more, which is 0.25 contact hours, and an application has to be a minimum of 30. So most of you will be doing a 30-minute, if not more, pharmacotherapy round, so you all could do an application type, which I feel is I'm encouraging that. Because I think it's also important that the learner not only takes that knowledge, but applies that knowledge from your pharmacotherapy round. So I would encourage you to do an application type activity, but you can do knowledge. That being said, we need to make sure that the learning objectives are aligned with this activity type. And as you know, one of the components of a learning objective is that verb. So verbs that imply knowledge are things like define, list, describe. Whereas application would be calculate, recommend, compare, analyze. So you can see the differences. Again, if you're doing an application type activity, you want to make sure that you use an application type verb. Now, someone may ask the question, if I have an application type activity, do all of my learning objectives have to have an application type verb? No. You can have some knowledge, but there should be at least one or two application as well, okay? But if you have a knowledge type activity, you shouldn't have any application verbs, okay? Again, we're going to talk about learning assessments. So typically for the knowledge, what's most commonly done is asking the audience questions where they recall facts. So like simple multiple choice questions or true false questions, but making sure though that those questions are aligned with the learning objectives, right? So that's how you're going to accomplish that assessment piece. And then the feedback, typically in rounds, it would be immediate feedback. So you may have a slide with a question, and then you're going to immediately give the correct answer to the audience. ACPE only requires you to give the correct answer. However, I encourage you to go a step further in terms of if you have a multiple choice question, well, why are the other ones incorrect? And in addition to why this one is correct. So you could do that as well. So give that immediate feedback to the learners. So a little bit more about creating activity objectives. I already mentioned a little bit about the educational needs assessment. So, thinking about potential actual problem in pharmacy practice, the gap, and then how you intend to address that gap with your pharmacotherapy rounds, given the target audience. Identifying the root cause of the identified gap. So oftentimes it's either going to be knowledge. So for example, pharmacists currently lack the knowledge let's say it has something to do with patient education on a new medication. So maybe the cause of that gap is they just simply don't have the knowledge, or maybe they don't have a certain skill or experience. So you need to provide what the cause of that is. And then again, how is your activity going to bridge that gap? How are they going to allow those pharmacists now to provide patient education on this new medication? You're going to plan the activity. So in terms of the content, the delivery, determine what participants will take away from the activity. And then only at that point, you're going to create your learning objectives. So again, the objective, as you probably know, is centered upon what the participant should be able to do at the end of the activity. They must be specific and measurable. That's probably the most important one. Develop to address the identified educational needs. So again, thinking about the purpose, thinking about that gap analysis and needs assessment, making sure that the learning objectives you're writing should be aligned with that. Again, they also need to be addressed by an active learning activity, as we mentioned, as well as covered by learning assessment. So at the conclusion of this activity, the learner should be able to do, and then you state what the learner will be able to do. Again, I mentioned the verbs, right? There were certain verbs for knowledge activities. There were certain verbs for application activities. And then we have a STEM. So the verb you choose by the activity type, as I mentioned. And then the STEM is simply the outcome-based takeaway. So for example, recognize anti-neoplastic agents that have similar toxicities may be an example of a learning objective. Is this, as written here, is this learning objective knowledge type or application? Anyone just yell out? I think I heard it. Knowledge. Thank you for speaking up. Yeah, knowledge, right? Yeah. Okay. This Bloom's taxonomy is a little bit cut off here at the top, I think. But a lot of you have probably seen this before in terms of the hierarchy of learning, in terms of remembering, understanding, applying, and analyzing. So in terms of pharmacotherapy rounds and the ACPE classification, most of you will be developing presentations that are knowledge or application-based. This slide here is just giving you some additional examples of learning objective verbs. There are some common mistakes. So avoid using verbs that are vague or cannot be objectively assessed. So I do continue to receive learning objectives say understand. But how do you measure someone's understanding, right? It's not specific. It's really not measurable. So appreciate, know. So these would be common verbs that are used in learning objectives that should be avoided. Again, what do you want the learner to be able to do as a result of completing your educational program? Not necessarily what the speaker will do. And again, they must be measurable. So here's some examples of learning objectives. To acquaint the clinician with the key clinical features necessary for the diagnosis of the common rheumatic disease. So what do you guys think here? Is this an appropriate learning objective? Yes or no? Anyone want to volunteer? Yell out. What do you guys think?
Well, I see that there's the word understand, and you did state that it's a common mistake.
Oh. So this is the first bullet. Is this, can I see this? Oh, okay. Oh, okay, thank you. Oh, so you're looking at the entire slide, correct? I'm not sure who's speaking. Someone, oh, thank you. You're looking at the entire slide, right? Okay, thank you. So 1, 2, 3, the fourth bullet, right? I agree, that is not an appropriate learning objective, correct? Because it has the word understand, right? So understand how to implement a nutrient management plan. So maybe what might be a better verb to use there? Maybe describe, right? Describe how to implement a nutrient management plan, okay? Rather than use the word understand. What about to acquaint the clinician? Is this actually a learning objective, or is this maybe something that the speaker wants to accomplish, right? Yeah, so that's not an appropriate learning objective there. Recognize antimicrobial agents that have duplicate coverage. I see some heads nodding. This would be appropriate, right? Is this a knowledge type or application type? Knowledge type, right? Correct. To update, reinforce, provide new information regarding etiology, pathogenesis, and so forth. What about that one? Again, it's not what we want the audience or the learner to accomplish, right? This is simply what maybe the presenter wants to accomplish, okay? Given a case of a patient with diabetes, develop an evidence-based regimen for attainment of blood glucose targets. I'm seeing some nodding heads. This looks good, right? You guys might want to use this for one of your rounds, right? I'll just copy and paste this here. Is this application or knowledge type, that learning objective? Application, right? Now, again, you might be bored here. It's like, oh God, what is it? You'd be surprised the learning objectives I received in the application. So there's a reason why we're doing this. So hopefully I won't have to get back to you and say, what are you thinking here? Yeah. Okay. List the steps in preparing a compounded sterile product and prepare a compounded sterile product. What do you think about that learning objective? It seems okay, right? Could it be better? How could it be better? It's kind of asking two things, right? Yeah, so my recommendation would probably separate out into two separate learning objectives. And list one is a knowledge type, but combine it with a application type, right? So my recommendation here would be is that most likely just split that out into two separate learning objectives. Okay. So you didn't realize there'd be some active learning today, right? This is exactly what you're going to be doing in your pharmacotherapy rounds, but better. All right, so again, students take a greater responsibility for generating new knowledge during educational activities. I'm sure all of you here have had active learning experiences in your education. As the presenter for pharmacotherapy rounds, you will be a facilitator in terms of imparting knowledge and application of that knowledge, rather than just simply talking at someone. So it does enhance overall learning, retention, and satisfaction with educational activities. And there should be at least one active learning activity for each learning objective. So this is kind of a good guide. You know, if you have 2 learning objectives, 3 learning objectives, to build in a active learning component for each of those learning objectives. Now, this is not all inclusive, but these are some of the more common active learning strategies that are utilized. So like for a knowledge type activity, it's very common that you would put in, polling the audience with multiple choice or true false questions throughout your presentation. Or maybe have some games or quizzes to practice recall. So again, that's the purpose of these knowledge type active learning, is to recall facts, not apply. Whereas you can see in the next column, application based, there's a lot more options in terms of active learning, whether it's role playing or simulation, or maybe a patient case study where they can apply the knowledge. Finally, it is important to give feedback and also to assess the learner's achievement of the learning objectives. So for knowledge-based activities, this would just require a single thought step again, right? Keeping things simple. Traditionally, again, multiple choice, true false questions. Fill in the blank charts, fact-based questions. Typically, we'd ask that you do 1 question per learning objective. So again, based on the guidance from the previous slide. And again, the feedback is immediate. So if you ask a multiple choice question or true false, you're going to give that feedback about what is the correct response to the audience. For application-based activities, this may require multiple steps or levels to get to the correct answer. So having like a complicated patient case would be an example. And again, you would give immediate feedback to the learner. Questions about this? Okay. This is actually something new that came out from ACPE regarding the use of artificial intelligence and language models. Is it okay to use AI or language models in the development of your pharmacotherapy rounds? Well, according to ACP, yes, it is okay, but I checked with the RPD as well. But it is okay. They only ask that you disclose this information. So if you do use an AI platform to develop your CE pharmacotherapy rounds, you need to disclose the name of the AI application, what version of it is, the purpose for which you use the A application. For example, some folks may use it to generate an outline for your pharmacotherapy rounds presentation. So you need to disclose that as well as the date the A application was used. Final reminders, so again, pay close attention to the submission guidelines once you receive those. It is important to avoid commercialism and bias in marketing in your presentations. And again, don't forget active learning. Keep the audience engaged. Provide at least one active learning activity per learning objective. And also, don't forget to assess the learner's achievement of that learning objective. So, something that can also commonly be done is, two birds with one stone kind of a thing is that, let's say you have a knowledge type activity. I'm going to use multiple choice questions, right? I'm going to poll the audience. So that's the active learning component. But as long as those questions are aligned with your learning objectives, you can also assess achievement of those learning objectives. You don't have to do different questions for the assessment piece. So the assessment piece, right, and the active learning could be one and the same. More information, we have hyperlinks that will be sent to you. I already introduced myself. I also work with Kathleen Dury and Jill Sullivan in the Office of Continuing Pharmacy Education. So any of us would be available. If you have further questions or concerns, you can reach out to us. I think that's it. Any other questions from folks? Okay, well, thank you for your participation and your attendance. And I wish everyone the best of luck in your residency fellowship year coming up.